Hello and welcome. My name is Anna Lee, and I will be talking you through Precision Ketogenic Therapy, or PKT. PKT is a unique therapeutic program with goals of improving seizures and alertness. For this first video, I will be talking about what therapy is and how food can be used as therapy. Therapy is a word for something that is intended to treat a disorder. To treat seizures, there are two main therapies: medication and nutrition. For nutrition therapy, we prescribe food to prevent and reduce disease symptoms. When most of us hear the word therapy, food is not the first thing that comes to mind. Food is how we fuel our body, and what we eat determines how our body functions. When a patient presents with epilepsy, they are often prescribed pharmaceutical medications. However, this type of medicine does not work for everyone, meaning they have refractory epilepsy. For patients that do not see results they wanted from these medications, precision ketogenic therapy can be prescribed. The goal of PKT is to improve quality of life more than medications were able to. PKT can be used alone or in combination with pharmaceutical medications in order to achieve the desired outcome. If someone continues PKT, the goal is that eventually we can reduce or eliminate seizures and the need for pharmaceutical medications. When we consider using food as a form of medicine, we must carefully decide what will be prescribed. PKT takes into consideration all the nutrients in the food we eat. To do this, it is important to know what makes up our food. We get energy from our food, which allows us to carry out our day-to-day functions. Food is composed of fat, carbohydrates, and protein. These are all things that can impact our body in different ways. Carbohydrates are important because they serve as the body's primary energy source. With PKT, however, fat is used for energy. Fat plays many important roles in the body, such as transporting certain vitamins and keeping our heart healthy. Protein helps you with growth, strength, and repair. It is important we consider the ratio, or what percentages, of each of these three things we consume when using food as a form of medicine. For seizure disorders, the ketogenic diet is often used. The ketogenic diet reduces the amount of carbohydrates consumed and replaces these carbohydrate sources with fat sources. This means that the ketogenic diet will have more fat and fewer carbohydrates when compared to a typical diet. The ratio of these nutrients is not the only thing taken into consideration for PKT. The quality of each of these things is very important too, as we want the best outcome for your child. For example, you may have heard that there are good fats and bad fats. We try to include as many good fats as possible to keep the PKT diet healthy. We will go more into detail about the diet's composition in a later video. In summary, food can be used as a type of therapy just like pharmaceutical medications can. Medications are not always effective, and PKT is one alternative. The diet is notably low in carbohydrates, but there is no need to worry because the body still gets all the energy it needs from fat. Our next video will discuss PKT in more depth.